thank you very much for joining us again today, Adam. I'm certain we'll be able to hear each other this time, right?
Yeah, I can hear you just well. Thanks for having me back on the show.
So, I've been watching with interest on social media. Boy, you cover a lot of things, and it's fantastic out there. But the one I do want to discuss has been the safer supply. Almost, I say it as a cult-like advocacy. I mean, the people who were pushing for this, just the advocates are getting so extreme. I mean, to the point of looking to sabotage conferences, coming after you, and just a refusal to look at the consequences of these policies. What's going on out there, Adam?
Well, I mean, it's a long story, but what I have to say is that addiction policymaking in Canada is dominated by a clique of activists and activist-minded researchers who, for 20 years, have been championing this radical harm reduction ideology that has facilitated countless deaths, because we're really not solving this addiction crisis. They claim to be evidence-based. They're often not. Their definition of evidence is quite questionable. For example, many of the studies that they have which support safer supply amount to just interviews with drug users who are on this program. And then the answers given to those interviews are framed as objective proof that it's working. So imagine, for example, you go up to a drug user who is receiving free opioids, and we say, oh, do you like this program? Is it benefiting you? Are you selling the drugs? And the guy says, oh yeah, it's great. It's wonderful. Of course I would never sell the drugs. And if I do, it's only out of compassion. There's no downsides. And the researchers say, oh yeah, you know what? We're going to believe him. And we need to expand safer supply because this is evidence that this is true. And this is evidence-based policymaking.
And it's just absurd. I mean, if it worked, if we could see results, if we could see people's lives really being saved, if we could see a decline in overdoses, a reduction in addiction, I'd support it too. But we're just not seeing it.
We're really not. And here's the thing, is that the largest study ever conducted on safer supply was published in January, and it was published in the British Medical Journal, and it claimed that safer supply led to a 55 to 91% reduction in overdose deaths. But I reviewed the evidence and the underlying data with a team of 6 physicians, all who have a background in addiction medicine, all of who are distinguished, and we realized that the researchers actually fudged their interpretation of this data, and that when you actually fully filtered out confounding effects and measured long-term outcomes, safer supply had no statistically significant impact on death. So essentially, these researchers found this robust data that showed that safer supply didn't work, and then they misrepresented the data to imply that it did. And I think that that's deeply unethical.
Absolutely. But what I don't understand, as I said, is the almost religious hang up advocates have with it, to the point of, again, I was just shocked when you wrote that piece about they were looking to even dye the water in a fountain red or do things like, where are these people coming from? Why are they so fixated on this? I mean, I understand compassion and concern, then why aren't they looking at evidence-based instead of this strange obsession with this?
Well, I mean, there's different groups here, right? So I feel the most compassion for the grassroots organizers who are dealing with addiction every single day and who are watching their friends and associates die. That's really traumatizing. We've seen such a rise in death over the past 10 years that it's understandable that these activists are desperate in a way, and they are searching for anything which could potentially save their friends' lives. But when you're in that kind of mind space, sometimes you're willing to make compromises, and you are willing to believe, to really delude yourself into thinking that something like safer supply is an effective intervention when in reality it's not. I think also there's a lack of understanding of the weakness of the evidence-based and safer supply. Many safer supply advocates think that these studies are legitimate, but once again, when you break them down, you find that oftentimes they have really weak methodologies or really strange interpretations of data.
Yeah, and some of the stuff we can see is anecdotal, but people getting out and being, on the streets. Paradoxically, one of the commenters saying, and yeah, in Calgary's Beltline, I mean, it's just horrific. It's dystopian. And we know that Vancouver, of course, has really been the epicenter of it. But, the failure, unfortunately, of current policies, and I don't think anybody's really found a solution yet, but we just know there's a tragic, horrific problem of addiction going on out there. But some of it's been exposed. I mean, there was a recent piece, I'm forgetting which one it was now. It was, I think, from the UK, but I mean, it was some photojournalism and some fantastic work just to bring it home for people who perhaps don't get out of the suburbs or don't get out of rural areas, just to see how awful and terrible this addiction epidemic is. I mean, how it's eating people alive out there.
Well, I mean, that's the thing, is that we have to all recognize the fact that this is a real crisis that is taking thousands of lives every single year. Overdoses now, drug-related deaths are like the leading cause of death for youth in BC. And our governments are saying that they're taking this seriously, but they're not. We don't have significant investment into treatment capacity in BC, for example. It takes a very long time to get into detox. It takes a very long time to get into a rehab center. Same thing in Ontario. In Alberta, it's much better because Daniel Smith has been investing heavily into treatment services, but it's still not where it needs to be. So we constantly talk about, this illicit drug crisis and all of these overdoses, but it's really rhetoric. There's no real action here. And even these big interventions like, safe supply, people say it's the compassionate thing. Unfortunately, it is actually just the lazy solution. It is the cheap solution, because getting people better, giving them the comprehensive supports, the housing supports, the employment supports, the counseling needed for them to reclaim their lives is expensive and complicated. It's much easier and much cheaper just to give people a bottle of pills every day so they can go kill themselves slowly.
Yeah, and then not only is it not effective in getting people, off of their addictions that are slowly killing them, when we get diversion of these, the risk now, and there's evidence starting to show that it's actually causing harm. It's creating new addicts, which is even more devastating. I mean, it's bad enough to have a policy that's ineffective, but this policy could very well be making things worse.
Oh yeah, no. The safer supply policy is obviously exacerbating the addiction crisis in Canada. And so for viewers who haven't been following, the safer supply is this idea that we give out pharmaceutical alternatives to illicit street drugs. Let's say Corey gets addicted to fentanyl because he's really stressed, running this show. You need something to take the edge off. So Corey, you're addicted to fentanyl. You buy your fentanyl off the street. It could be contaminated with xylazine, with other forms of fentanyl, like carfentanil, which is much stronger. The dosage is unpredictable. So you could easily die from buying drugs off the street. So the idea here is that we give you drugs of a known potency and of a known purity, so pharmaceutical drugs, to keep you alive until you're ready to seek treatment. Sure, that sounds great in theory. In practice, though, the drug we give, hydromorphone, it's as potent as heroin, but fentanyl is 50 times stronger. So, Corey, if you get a bottle of hydromorphone and you take it, it's not going to do anything for you. It's too weak. And so you do the rational thing that any person would do in the situation. You sell your hydromorphone at rock bottom prices because you got it for free, and you use that money to buy your drug of choice, which is fentanyl. So not only is this program not mitigating the illicit fentanyl market, it's subsidizing it. And it would actually make more sense for us just to give you cash, right? But to buy your fentanyl. But at this point, because you're selling this, you are flooding communities with hydromorphone, so essentially government heroin. And then because experienced drug users don't want it, it goes to people who are opioid naive, it goes to kids, it goes to people in recovery. The kids will take it because they don't know what it is. It's a pill at a party. They're told it's a prescription pain medication. It's safe. It's from the government. Then they get hooked. Then they graduate onto fentanyl, and it kills them. This is an absolute disaster.
And something else, Jordan, one of my commenters pointed out, which is another thing, we're getting hints of there might be some people with a vested interest in business interests in being part of the dispersal of the safer supply. I mean, that's kind of a different rabbit hole to go down, but unfortunately, some people are finding themselves with a financial interest in the status quo, which is morbid, but another thing to look into.
Well, I mean, the problem here is that clinics can make a lot of money by prescribing safer supply. You have people coming in, you have your patients coming in all the time to get their safer supply prescriptions, versus if you put them on Sublocade, for example, which is a once a month shot. The pharmacies are making an absolute killing because they dispense the safer supply every single day. So you're charging a dispensing fee every single day for every single patient. One doctor who I spoke with estimated that a single pharmacy can make $1 million a year off of 100 patients. So yeah, Shoppers Drug Mart, for example, gave about $2 million to the BC Centre for Substance Use to encourage them to create like training programs for safer supply, and I think that's a huge conflict of interest. Purdue Pharma, which was the really awful company that was behind the OxyContin crisis and started this whole opiate addiction in the first place, this crisis. They produce Dilaudid, which is the brand version of hydromorphone. So they are making a lot of money off of this as well. And I'm aware of the fact that they are currently lobbying some governments about safer supply. I still need to fully investigate that. So yeah, there's a lot of pharma money involved here, which I think is really concerning.
And I guess something that has to be, you pointed out as well. I mean, full treatment, the counseling, the housing, the time, it's very expensive. You need facilities, you need trained staff, you need resources. Alberta's working along that course, but I actually have a family member who's been in and out of rehab once now, and it didn't work. It could take multiple visits, and they say, yes, you certainly are addicted. You would qualify. Come back in 30 days and we'll probably have a bed for you. But unfortunately, living on the streets for 30 days, your chances aren't looking very good at all. But I guess people have to realize that the investment in these facilities, too, as expensive as they sound, we're still paying, because the person I'm speaking of was in and out of conventional hospitals chronically, in and out of shelters. Often people are in and out of jail. We're paying anyway. So we could spend those dollars better if we're trying, at least, even if there's a limited success rate in rehab. But hopefully we're starting to realize that. I mean, in BC, they've gotten rid of reality seems to be sinking in with that government.
Yeah. Well, that's the thing. As you said, our capacity here is quite limited, right? So if someone has to wait 30 days to get into rehab, then that's going to make it very hard for them to get better, because you make that decision, you want to get better, but then you have to wait 30 days. Well, you're going to start using during that period. And then in 30 days, you may not want to go to rehab. It costs a lot to do all of this. As you said, we're already paying a lot. Our healthcare system is strained to the max. And part of it is because we have a small number of severely addicted people who are visiting hospitals again and again and again and again. So it would be fiscally responsible for us to put them in a treatment center instead, and could also improve healthcare access for everyone else. It just makes sense.
Yeah, well, it's a large and complicated problem. I mean, part of it too is at least letting people know so they can let their representatives know, I mean, how acute it is, and encourage them. I mean, I think most compassionate people, when they realize just how bad it's getting, would support the investment in rehab and a results-based policy. But I mean, it takes exposure. It takes letting people know. As I said, if they live in the suburbs and don't get downtown, they might not realize how bad it is until it costs them directly. So, I mean, just kind of, to wrap things up, you've been fantastic in covering this and exposing it. Where can people find your work and keep track of what you've been writing on?
Well, I mean, I'm a columnist of the National Post, so I think you should subscribe to the paper. It's great. There are also many other great writers there. And then on top of that, I run a nonprofit called the Center for Responsible Drug Policy. And we have a little Substack called Breaking Needles. So you can go find us at www.breakingneedles.com or responsibledrugpolicies.com. Either will give you access to all sorts of great material on addiction that challenges some of these, narratives of radical harm reduction that have ruined our country.
Well, that's it. I mean, just applying some common sense or looking for results. I had a doctor, Monty Ghosh, on. He specializes in addiction treatment. And you talked to, we don't have time to go into the whole thing of consumption centers. There was this horrific case of Vancouver when I saw it. Looked like an opium den of old with what it turned into. But the effectiveness of safe consumption is typically only good for about 500 yards, he said, from where the addict is. Otherwise, they're not going to travel that far. And we just don't have the resources to set one up every 500 yards in every major city. So we got to think a little harder on it.
Yeah. If we're going to spend the money, rather than spend the money on putting a safe consumption site everywhere, we should be spending money on building up treatment capacity. It's a better investment to get people better than to enable their addictions and let them slowly kill themselves.
Absolutely. Well, thank you very much for joining us today, Adam, and for the work you've been doing and exposing this. I really appreciate it. And I hope we can have you on again sometime soon to talk again.
Likewise. Thanks for having me on the show.